So pickleball is one of the fastest growing sports throughout America. It's a very safe and low impact sport. However, there are certain injuries that can occur. So with that being said, I would like you to take you through 3 of the most common injuries that may happen. So my name is Dr. Patrick King. I'm a non-operative sports medicine physician with Rothman Orthopedics in partnership with AdventHealth. So without further ado, let's get into it. So one of the most common injuries we'll see with pickleball is going to be lateral epicondyle tendinopathy. And it typically is named tennis elbow, but we can apply that to pickleball, and so you'll get this pickleball elbow. And what that is a chronic overuse injury of the common extensor tendon as it inserts on the elbow. It'll progressively worsen with time, and people will eventually have difficulty gripping the paddle and or going through on their follow through. And so what it is, it's actually a disorganization of the tendon itself. And if we catch it early enough, we can actually treat it fairly quickly. But if we let it go too long, then that's when it becomes much more difficult to treat. So if you have this pain localized over the outside of the elbow, and it's been quite bothersome and it's starting to affect your play and your game, I would encourage you to get in sooner than later. Let us take a look and we'll get a plan together on how to treat this appropriately. So when you read the literature, a lot of people will talk about some simple things that we can do at home if you're already experiencing that pain over the lateral or the outside of the elbow. One of those things is we talk about ice or heat. And I tell people to listen to your body. If ice feels better, then of course do that. If heat feels better, then go ahead and do that. I do like heat. I think heat applied to the area actually makes it feel better. The other thing we will do is we'll have people pick up a counterforce brace, and it's very simple. You can purchase them on Amazon, and what they do is they apply pressure just distal or just below that tendon and where it inserts, and what it does is it transitions that force of how the tendon is being applied, and that may help the pain. The other thing that we start to talk about is what's called eccentric exercises. And so what that is when that wrist is flexed back, that's a concentric load. So if you just take some pressure and put on that wrist and the hand and let it go down slow while you're controlling it, no pressure when you come back up, pressure again, slow down, that's going to create an eccentric load at the elbow, which has been shown to be fairly effective at getting this to recover. And then surely if that stuff doesn't work, we can see you in clinic and we can talk about some more off-labeled or uncommon things that we will see. One of the things I do not recommend is steroid injections, but that's because of the sequelae or the negative effects that potentially happen down the road. There are some other things we can talk about, platelet-rich plasma, but they're fairly expensive. So there's some inexpensive things like topical nitroglycerin, which is very unique and new to the field, but it's one that I've used for some time. And so if this is not getting better with the simple stuff at home, by all means, please come in and see us and we can go from there. So another common injury in pickleball is going to be within the shoulder itself. You know, as we're coming through and we go through that swing, sometimes we'll get pain that's been there for a while and it's progressively worsening versus pain that acutely happened. And there can be multiple different causes for this. Rotator cuff tendinopathy, you can have this impingement syndrome. You know, in worst case scenario, there's always that chance that you can tear a rotator cuff tendon or muscle itself. It's not common, but it does happen. So if this does occur to you, I would encourage you that if you have significant or notable weakness in the shoulder, come in and get it looked at. Otherwise, if you don't, then what you can do is try to treat it conservatively at home. Those are things like anti-inflammatories, ibuprofen, Aleve Tylenol. Try to get that pain under control so you can keep moving that shoulder. The last thing we want you to do is to stay immobile or keep the shoulder stiff, because if you do, you can transition into something that's called frozen shoulder, and we don't want that. So then you keep moving the shoulder, and as you go through, and you can progressively strengthen the shoulder. And an easy way to do that is grab yourself just a simple rubber band, it's called a TheraBand, and you can attach it to a wall over here or a door, and you grab that band, you externally rotate 10 or 15 times, and you attach that band to the outside, internally rotate 10 or 15 times. Then you take that band, you step on it, and you just lift it up in this plane, and that's going to progressively help strengthen the shoulder. As long as your pain continues to subside and improve, great, leave it alone, get back on the court. If it doesn't, come back in, to the office. Let's get you evaluated and figure out what exactly is causing it, and then go from there. And so the third and final topic we're going to talk about is knee injuries. And knee injuries are very important. In pickleball, one of the things I love is that it is a low impact or risk sport. However, the knee is incredibly important. As you can imagine, as we're stooping down, we're twisting at that knee, and we may even have falls that land on the knee. And so with that being said, we can get the chronic overuse things, the tendinopathies, that quad tendon, the patellar tendon. You can injure that patella underneath where it articulates on the femur, which is called the patellofemoral compartment if you were to fall on it. But probably one of the most big things that we need to pay attention to are these meniscus injuries. So the meniscus I describe as somewhat like a shock absorber in the knee. It's classically injured by someone having that flexion and twisting at the knee, and you can catch the meniscus and you can tear it. Most of the time we will try to treat these conservatively and get you better without any kind of operative intervention, but surely if it's causing severe pain, difficulty walking, you come into the clinic, let's take a look. Most notably, if you have mechanical symptoms, locking or catching, that's one thing. If that knee is locking up, you don't want to wait. Come in sooner. Otherwise, you can try the conservative stuff again. Anti-inflammatories, ibuprofen, Aleve, Tylenol, as long as you can take those with your past medical history and medications you're on. And let it calm down with time, progressively return to athletics, and as long as you're doing well, great, we'll leave it alone. But otherwise, if it continues to plague you and it's painful and you just can't get back to the full game that you're used to or you want to be at, by all means, please come in, let us take a look, and then we will go from there. So if you're having this injury of the elbow, the shoulder or the knee, I would encourage you to make sure you take care of that. One of the recommendations I give all of our athletes, whether it's our young high school athletes to our collegiate athletes to our pro players, is that we have to take care of our body if we want to be able to get out and actually play the sport and do the things that we want to do in life. And so it's incredibly important. It's one of the things that we as non-operative physicians are very energetic about, is that not only that preventative treatment, but then also treating the symptoms you have quickly to get you back to that full level of play and sport and athletic where you want to be. So by all means, if this is bothering you and it's not getting better with the simple stuff, please don't wait. Come on in, let's take a look, and let's get you a better diagnosis and treatment plan. Thank you so much for providing me this opportunity to speak with you today, and surely for taking the time out of your day. I wish you the very best in your upcoming athletic endeavors. Thank you. All right, Clifford, let's get out and play.